Good morning. Welcome back to Mull. Those of you who live in this region will have realised that I've had some big wins in the last 24 hours. Such was the strength actually, and such was the traction on my old hairstyle that just look what happened. It just pulled it off. So I'm now a little lighter and floating on air. Now today's message from Mull. This is Rob Graham, by the way. It's not an imposter if you've been used to the old hairstyle. Today's message from Mull is rehab or prehab, and can you develop some resilience in a post-lockdown world? So most of you will probably know that a lot of our work is rehabilitation, and that can be after a disease, a disorder, maybe some surgery, an injury, trauma, mental health problems, and even more natural things like aging or pregnancy, for example. And a lot of people get referred to us so that we can maximize their ability to live and to work and to learn and basically operate at the height of their potential and improve their quality of life, really, and reduce the effect of aging, which comes to us all, obviously, but we can fight it, and we should fight it all the way. And obviously this is very important for those who are post-COVID-19. There are some in the area, obviously, but also those who are coming out of shielding, where their functional capacity might have deteriorated somewhat just because of lack of movement, basically, because we have predominantly been spending more time inside and not getting out maybe as often as we would have liked to have done. And this can also lead to mental health issues and also to cognitive impairment. And for those that have been perhaps in hospital for long periods of time fighting COVID, potentially post-traumatic stress disorder. So we're now facing quite an anxious world, and COVID-19 obviously has had some significant effects, and we're still learning about this disease and how it will affect us long term. I have a good friend down in Newcastle, a paramedic, who contracted the disease, and that was way back in sort of April time. And she's still finding that her sense of taste and smell is affected, and we know that's one of the key sort of criteria in terms of diagnosis now. So we also know that it affected the Black and Asian and ethnic communities in a big way, but also those with a history of smoking, with lung issues. Mids are starting to come out again, and those that are overweight, those with diabetes, and also the frail and the elderly, and those suffering with various forms of dementia as well. So the question now really is, yes, we need to rehab a lot of those people, but looking forward, could you make yourself a bit more resilient to this form of disease? There is the potential of a second wave coming. We're hoping that there will be a vaccine in the not too distant future, probably likely to be next year by the sounds of it. But can we make ourselves more resilient to this sort of issue or any sort of unplanned stressful situation that your body may face? Because the world's an unpredictable place, and obviously health conditions are an unpredictable thing. So could we look at some prehab? Now, prehab is something that has been around for a little while now. I would say in the last 10 years in my role, I've seen a lot more people referred to organisations like healthyoptions, especially as they come up perhaps to some planned surgery. And probably the majority are things like knee replacements or hip replacements. And what we know from feedback from consultants is that a lot of the people we work with, their discharge from hospital has been quicker, and the consultants and surgeons have been quite impressed with the condition of the muscle tissue around the joints that are being replaced with those who come on a planned exercise program. Oof. The wind has gone away, unfortunately. So what prehabilitation really is all about is increasing functional capacity and mental resilience ahead of a stressful event, so that we minimize impairments and we make rehabilitation that bit quicker and more effective. And sometimes we also get that for those that are going in for, say, cancer treatments, radiotherapy, chemotherapy, and that's definitely more about improving their mental resilience before the start of those processes, which can also obviously be quite a hard time for people. So what we're really trying to do in that case is place you in a position of preparedness, so that if we do face some sort of stressful event, say COVID-19 for example, that your body is in a much better position, not just to fight it off, but to cope with the symptoms and to bring you through much stronger. And obviously with COVID-19, it's an issue that affects the lungs in a big way and our ability to breathe. So the more efficient our bodies are at utilizing oxygen, and the more efficient our respiratory system is, and our cardiovascular system, then the better we're going to come through that process. So really, today's message from Mull is trying to get you to think ahead and think about the unpredictable. I know that's hard because we tend to always react to things when they happen. We're quite a reactive animal, really. But can we prepare for the potential of a stressful situation? Because it's going to come to all of us at some point, not COVID-19, but some sort of stressful situation, some sort of issue with our health. And obviously the fitter and the stronger we are before that happens, we hopefully stave it off and delay the potential of any issue. But if it does come along, then we're in a much better position to rehabilitate ourselves and to fight against that health condition, whatever it may be. So basically, what we do is focus on exercise, on diet, nutrition, on mental health, and sort of social connectiveness. That's not easy to say, and that's been quite difficult at the minute via Zoom. Although we had a great little session yesterday on our Zoom call with several of our clients, and it really showed me just how far Healthy Options has come in the last couple of years, and I'm very proud to be part of that. And what we need to do really is focus on the person and not the health condition, and hopefully with help from Healthy Options, from NHS, from your GP, from carers, from loved ones, then we put ourselves in a much more resilient place to face the future, regardless of what's on the way, and really empower you to manage your own health condition going forward and remain as independent as you possibly can. And for us and the NHS, one of the big things about that is it stops this revolving door process where people come for hospital treatment, are discharged, and then don't take responsibility for their own health and end up coming back through the system time and time again, which is no good for the individual and certainly not cost effective for the NHS. So that's today's message. Think about prehab. What can you do to place yourself in the most resilient position you possibly can going forward? And obviously that revolves around your activity rate, your diet, nutrition, and how you can improve your mental health or maintain good mental health going forward. So let's hope the weather picks up a little bit for the weekend. I will see you all next week. Have a lovely weekend, and as always, stay safe, guys. Bye bye.